as we have seen in our earlier videos also, so at PRS Neurosciences, chronic pain is something which is treatable. Hi, my name is Vandana. I'm a physiotherapist, and today we are going to speak what do we do in PRS about chronic pain. So when you know
1, 2, 3, 4.
chronic pain. So when you know what is chronic pain, it's something which is more than 3 months. The pain which is there from even more time than 3 months, it's called as a chronic pain. So it can be because of multiple reasons. One of the major reasons what we find out in PRS is something called as psychosocial variables, or the psychogenic variables is something which are majorly left untreated. So in such kind of patients, they have a pain and it keeps going on and on. So they get into a vicious cycle where they say that I have a pain, if I do this, the pain starts reducing. If I don't do this, sometimes the pain starts increasing. So they don't have a specific pattern. Sometimes they say that the pain can increase, sometimes the pain can decrease. There's no specific pattern to it. So when we check such kinds of people or patients, we start treating them with something which is very, it's called as a placebo effect. So when we see them, when we see those cases, we speak to them. This is something which works a lot. Physiotherapists at PRS Neurosciences have a very good communication skill with the patient. They make such a rapport with the patient that they cannot even think that they are in pain. The next day, half of the patients come back saying that my pain is a lot better, or my pain has come down by almost 50%. And what we have done, majorly if you see many of the physiotherapists, when they treat with either ultrasound or interferential therapy, or it will be something like trigger point release or myofascial release, things like that. But here we start off with speaking first. We see if that helps. Majority of the patients in chronic pain fall into this category and are cured by this. So if suppose after that also if it is not curable, we do something where we say that we are giving a treatment, because that gives a lot of amount or a huge amount of satisfaction to the patient. Once that happens, they see and they think that there is this treatment going on and it starts getting better. But actually, if we see that the treatment is not going on, it's something which is said that, okay, so now are you feeling it? So we use all assertive type of talks where we say, so now you're not having pain, right? I think it's getting better, right? It's not in an opposite way where you ask the patient, is it hurting too bad? That makes the patient think, yes, it is hurting. So we use the opposite funda and we start talking in a way that they start telling, yeah, I think it's getting better. I think the intensity is more. I think the pain is coming down. So that is one of the most important things which we do at PRS Neurosciences. Also, we start checking off something which is called as your posture or your ergonomics which is going on from a long point of time. So whenever it is there, it can be because of the back, it can be for the back, it can be for the neck, it can be for multiple areas. So we check if there is any joint which is hypermobile or hyperflexible, and if there is any joint which is very less moving. And then we go on to see which muscles to strengthen, which muscles to inhibit, and what is the correct pattern to do any kind of exercises. So I would like to mention about one of the very interesting cases which I had seen recently. So the person is around 50 and he's a very passionate golfer. So he plays golf and he doesn't want to quit. But since the last 6 months, he has been suffering from so bad pain that he was not able to do anything. He even thought of quitting his job. There was pain whenever he used to get up in the morning, there was pain when he was doing anything, when he was just sitting also there was pain. So he used to explain that, Vandana, I don't think I want to continue this anymore, any kind of work. I'm very frustrated. It feels very depressing that every morning whenever I'm getting up with pain. When I'm going to sleep, I'm going back with pain. So it was very difficult. So in the beginning, whenever we start seeing any of the patients at PRS, we start seeing them as a neutral thing. Whichever things were done already, we remove that. We still see if there is a chance to recover the patient by doing something for the pain if the pain intensity is too much. So there is a scale, there is a rating where we rate it. So it's called as the pain rating scale or the numeric pain rating scale. In that, he said that my pain score is 7 out of 10, which means it was very bad, even at rest. So imagine someone who is just sitting like this and still having pain of 7. So he was having that pain and it was not going. When we started to reduce it, we started giving things. I started treating him with trigger point release. I found out there are a lot of knots which were there. I started doing that. I started doing stretching. Then we started going on to little more what was the main source. The main source was he had a very bad neck pain. So it was there from the neck itself. So he was not able to maintain his posture of the neck properly. That has been going on since years. So he has never recognized that or realized that my posture is wrong. So we started working upon that slowly. We realized that the movement or whatever movement what he was doing was not fine. Then we started treating that. Slowly he started getting that confidence. He said, whenever I used to hold the golf club, it was very heavy. It feels very heavy. I can't get the force. I can't get the shot proper. And I think I'm not going to play. So he started doing slowly. In a week or so, the pain came down from 7 to 5. From 7 to 5, from 5 again it came down to 4, 3. So slowly when he started doing more of his posture corrections, he started becoming more stress free. He started relaxing. He did not think that I'm not going to be pain free ever. He started saying good things that, okay, I'm getting better, I'll get even more better. I need to just do this right every single day. So every single day he started coming. Then I told him, sir, why don't you go and play golf? Just go, check. If there's a pain, we'll sort it out. Definitely we are there. So he went, he played, and wow, he didn't have any pain. So he was too excited. After 6 months, I could play golf without any pain. So there was an excruciating pain which was there, and today it was not there. So it was there, but it was around like 2 out of 10, which is minimal, and I can bear with it. He started doing the exercises regularly. He started following a very good posture. There are few things like getting up straight and other things which were going on from a long period of time. He started doing all the things right, and I think today in a span of maybe 3 weeks to 4 weeks, in 3 weeks to 4 weeks he was pain free. His pain was 0 out of 10. So this is one of the best cases that I have ever seen, and he's very happy playing golf now. So we wish that at PRS we can make many others like him who are suffering from a lot or worse kind of pains come down, so that they can do their functionality or they can do their simple day-to-day activities much more happily and much more easily without any kind of pain.